Let's get some work done.
In the final week of 2020, local leaders from minority advocacy groups came together.
Marginalized communities are left out of the civic engagement process and discussion.
This 2.5-hour live stream, hosted by Muslim Educational Trust and the New Portland Foundation, offered a chance to speak directly to public health and elected leaders.
Communities without power and clout.
Oregon Senator Ron Wyden sending a recorded message of support. These groups have something in common during COVID-19.
That certain racial and ethnic groups were disproportionately burdened.
Minority communities in Oregon have seen higher COVID infection rates per capita. So the big question to health leaders:
how the county has been addressing or plans to address the inequities between communities during the planned vaccinations.
Commissioners from Washington and Multnomah counties.
I can't think of a more important conversation to be having right now.
It lays bare what your strengths and what your weaknesses are.
To the director of Oregon Health Authority.
Sort of a foundational reimagining of how we do almost everything as an agency.
All addressed vaccine priority for BIPOC, Black, Indigenous people of color. Statistically, those groups have less access to health care and testing. Many are also essential workers, increasing risk of COVID exposure.
Our communities aren't able to work virtually.
The discussion here is not about why white people should not get the vaccine, but rather how more heavily impacted minority groups can get equitable access.
Because our community members come in contact with other community members and could potentially spread.
Advocacy groups have worked with state and county health departments for months on culturally specific outreach in many languages.
This is an unprecedented undertaking.
They've received millions in CARES Act funding to be the trusted buffer between marginalized groups and the government to share info and testing. Many pushed for a spot on OHA's COVID-19 Vaccine Advisory Committee.
More than 600 people applied to serve. That's a good thing.
OHA announced 27 made the cut Thursday. Their first meeting will be January 7th to help advocate for priority after healthcare workers and older people.
I want to tell you, I'm scared.
Some leaders here admitted uncertainty about the vaccine, but said they want to be an example to protect others.
My mind has changed a lot. I think the science is great, and I absolutely think that we should be doing this.
Putting in energy now.
This is how stuff gets done in our communities.
To reach those in need when the time comes. I'm Galen Etlin for KGW News.